Okay, good morning, everyone. Thank you so much for joining us. If you are joining us from Hong Kong, good morning to you. If you're joining us from a different time zone, good day. Welcome to a new edition of the Policy Dialogue Series 2022-2023. In this year's Policy Dialogue Series, we'll have Professor Anthony Cheung, joined by Professor Loy Tai Lok. And for each of the series, they will be accompanied by a distinguished guest speaker. In store in this year's Policy Dialogue Series, we have 5 dialogues, the first one of which will take place today. And today's guest is Professor Donald Lo. The topic today is the Still Unending Pandemic, Need for a Policy Breakthrough. However, we will have other policy dialogues, which I'd just like to let you know of so that you can mark your diaries. The second one will take place on the 3rd of December. It will also feature Professor Anthony Cheung and Professor Loy Tai Lok, and they will be joined by Professor Christine Lo. The third dialogue will take place on the 7th of January, 2023, and it will feature Mr. Brian Wong. The fourth dialogue will take place on the 11th of February, 2023, and it will also feature Mr. Brian Wong. The fifth and final dialogue will take place on the 18th of March, 2023, and I shall be accompanying our 2 distinguished guests. With that aside, I would like to proceed to jump right into today's dialogue series. As I've mentioned, the topic for today's dialogue is the pandemic, the need for a policy breakthrough. We have 3 speakers today. Going first will be Professor Anthony Cheung, Research Chair Professor of Public Administration at APS at the Education University of Hong Kong. Professor Cheung is also an adjunct professor at the Division of Public Policy at HKUST, and he's the former Secretary for Transport and Housing in the Hong Kong Special Administrative Region Government. He'll be joined by Professor Loy Tai Lok, who's a Chair Professor of Hong Kong Studies at Education University of Hong Kong. He's also the Director of the Academy of Hong Kong Studies and the Center for Greater China Studies here at the Education University of Hong Kong. As I've mentioned, they will both be accompanied by Professor Donald Lo, who's a Professor of Practice in Public Policy and the Division of Public Policy at HKUST. Before I hand the floor to them, I would just like to quickly thank both the Education University of Hong Kong and the Hong Kong University of Science and Technology. At the HKUST side, it was the Division of Public Policy, and at the Education University side, the Asian and Policy Studies Department, the staff and all the individuals who have been involved in making this policy dialogue series possible. With that, Professor Anthony Cheung, over to you, please.
Thank you. Good morning. If you look at the topic today, the still unending pandemic need for a policy breakthrough. So let me show you the PowerPoint. The topic poses 2 questions. First, is the pandemic coming to an end? The second one, do we need a policy breakthrough? So I'll try to address these 2 questions during my short presentation. It's not working at the moment. Okay. This happens from time to time. Let's look at the global situation. Is COVID-19 coming to an end? Meaning, has it become endemic? Now, most will agree that the Omicron variant and its subvariants seem to be a game changer. Now, if you look at what the World Health Organization has said over the past several months, at the beginning of the year, the Director General said, it's dangerous to assume that Omicron will be the last variant or that we are in the endgame. On the contrary, globally, the conditions are ideal for more variants to emerge. Now that message seems to be less optimistic. In other words, well, don't be over optimistic. The virus has not come to an end. We are not in the endgame. However, in mid-September, he said, we have never been in a better position to end the pandemic. We are not there yet, but the end is in sight. Now that seems to a more positive tone. Now, whether or not the pandemic has really subsided and come to an end, I think that is an issue hotly debated among the experts, and they are both more optimistic and less optimistic view. But I suppose most will agree that things are changing. The pandemic threat that we face today is quite different from that back in 2020 when it first started. Coexistence is something which is now increasingly taken as a given. Of course, coexistence doesn't mean that we human beings choose to coexist with the virus. Now, this is one way of looking at it. But another way of looking at it is that this is an objective condition. The virus has been able to adapt to human reaction, and the virus is going to stay for a much longer time endemic. So is that an unavoidable given at this point in time when we ponder the future? There are suggestions, there's suggestion in various quarters that we are now achieving some kind of hybrid immunity because of mass vaccination, and because in some countries and places, there is large-scale infection. In some countries, the infection rate is almost half of the population. So with vaccination and infection by default, some societies have achieved hybrid immunity. And over the last 3 years, the cost of the social and economic costs of fighting the epidemic have been increasing. Throughout the 3 years, most societies, most governments have been trying to strike a balance between safeguarding lives and keeping life and business as usual. The trade-off is difficult amid pandemic fatigue and resentment. And such fatigue and resentment have grown as restrictions become prolonged, as people wonder what will be the future? When will we go back to a more steady state of things? We have to recognize that the challenge in 2020 and the challenge today are quite different. I would say that at the beginning, whatever measures governments and communities across the world were taking were more health-driven. But from late last year onwards, they are more economics-driven. Economic rejuvenation is now top priority for many nations, including those nations that were previously suppression hardliners, like Singapore, New Zealand, and a few others. Economic pain is now harder to bear, particularly because of the Ukraine war that is driving up the cost of living worldwide. So the challenges that we face today are different from those 2 to 3 years ago. And the nature of the epidemic of COVID-19 perhaps is also changing quite rapidly. Now, most nations are now reopening. Now, if you look at the figure given by travel off path list of no restrictions, 5 no restrictions, 5 no's. No tests upon arrival, no tests upon and after arrival, and no countries banned due to COVID-19, no quarantine periods, and no vaccine requirements. There are now 15 nations. So the majority, many nations are moving into reopening. So that's very briefly is the global situation. What about Hong Kong? Where are we? And what is the real COVID-19 threat today? What do experts say? Now here I try to highlight a few points made among experts. First, despite the infection number, whether we think is high or not that high, serious cases are rarer, relatively speaking. Case fatality rate is not high. At the same time, vaccination rate is high at large. mild COVID-19 cases do not put undue pressure on our public healthcare system. Now, I'll show you a few slides. The first slide, the daily new confirmed cases and daily number of deaths reported for Hong Kong. And we can see that until early this year, the curve seems to be very indicative of good performance. But of course, because of the fifth wave early this year, the situation had become worse. But then over the last few months, if you look at the curve, it seems the situation is stabilizing, not alarming, particularly. Now, let's go to other trends. The moving average case fatality rate of COVID-19. Again, over the last few months, the case fatality rate seems to be stabilizing. Now, whether or not this is alarming is, of course, something for the experts to make a judgment. But based on what has been aired openly, it seems the experts do not find the current CFR too alarming. Over the last 14 days, 2 weeks, we'll see that case numbers, infection numbers, are relatively stable, around 5,000 to 6,000. Now, whether or not the number will go up or go down depends on how we react to the coming months, the coming the colder season. And but the number of deaths seems to be stabilizing as well. Infection vaccination rate, in a way, very encouraging. The blue line represents those having got 2 doses. And then the sort of grayish blue bars represent those receiving 3 doses, still very high, relatively speaking. And up to most recently, over 500,000 of our population has actually got the 4th dose. These days, people in Hong Kong like to compare Hong Kong with Singapore, and I'm sure Donald would say more about Singapore. But if you look at the stringency index, based on how different governments react to COVID-19, the kind of measures they have taken, whether they're stringent or less stringent, comparing Hong Kong and Singapore, roughly speaking, the degree of stringency in Hong Kong is double or almost double that of Singapore. Then the interesting question is, if we are more stringent than Singapore, double that of Singapore, is our performance much better than Singapore? I would say that if you look at the basic figures, infections, death numbers, fatality, case fatality rate, that is not the case. So then the question is, do we still need to be that stringent compared to Singapore? Right now, for Hong Kong, if we try to summarize the situation, because I think we are facing an existential challenge. If we allow the control measures, the control regime to continue to sort of a long-term given for Hong Kong. Because we are neither here nor there. We are not stringent enough compared to the mainland. So if we assume that if we are more stringent, then it will facilitate an early return to normal connection with the mainland. That may not be the case. But at the same time, we are too stringent compared to many overseas jurisdictions. So that hinders our connection on the global basis. At the moment, back to normal, is the largest consensus across different sectors within Hong Kong. So the question is not whether, but how. How meaning the way we approach this route towards normality, and also how quickly we should proceed along that path. To have a good, more realistic way of looking at this how question, I think we must know very clearly where we stand, our weak points, our strengths, our constraints, and opportunities. And we must listen to the experts because the government says we have to be precise, we have to be scientific. So what is the real situation? What is the real impact of COVID-19 and its subvariants? Of course, mutation is still going on. After the BA series, BA 5.5, for example, now we have XBB and other newer variants. But many experts would say that, yes, despite mutation, but the actual impact of the new variants is not that threatening. Actually, it's becoming milder. Now, should that be the case, then we have to adjust our strategy towards the epidemic. Hong Kong is facing an existential challenge. We must be open to the world as far as possible and as quickly as we can. Otherwise, our city risks losing its vibrancy and international competitiveness. At the same time, of course, we have to work to have to strive for resuming normal connections with mainland cities, particularly the Greater Bay Area. That is very critical for Hong Kong's growth, Hong Kong's business opportunities. But that is not something that Hong Kong alone can decide because it is subject to the mainland's assessment of the risk of spillover from Hong Kong. The mainland has its own concerns which might not be entirely shared overseas or by Hong Kong. However, we know that this is not something that Hong Kong alone can determine. So we have to have a more pragmatic assessment of where we are. If we don't do anything, then we may lose at both ends. So that is the real threat to Hong Kong. And we have to avoid any unnecessary or false binary thinking. We say we are not lying low, lying flat, but tongping. But that is not the same as adopting an unduly restrictive regime. How restrictive the regime should be proportional to the assessed risk. So how do we assess the risk? What do the experts say based on the current progress? I would say that if we take coexistence as a given condition, then can we have a kind of proactive coexistence strategy? We are not saying we don't control, we just give up. That is not the attitude. But whatever restrictive measures we take should be proportional to the risk, and we assume the pandemic to be somewhat unending but in a different way, because the nature of threat, the nature of impact may be different. The world is not becoming more positive in terms of the economic future. In fact, it's becoming more gloomy. The IMF, the latest report in October, says we are facing a more turbulent economic future. Slowdown, outright contraction might be the norm. And experts, economists, who say that we are now in a supply side crisis, which is quite different from the past. Recently in Hong Kong, the turbulence of the stock market, I think, is alarming, is unsettling. The government's policy, back in August, the chief executive, John Yee, said there are 5 pillars: not to lie flat, to reduce critical cases and deaths, to protect high-risk risks, particularly the elderly, children, and patients with chronic illnesses, and to have a kind of strategy based on scientific and precise assessment, as well as according to the different risk level of people in the community, and to strike a balance between the epidemic risk and economic needs. Now, these 5 pillars, I think, of course, in terms of policy foundation, is sound. The question is, how do you really make the policy according to these 5 general principles? In the recent policy address, these 5 pillars are re-articulated. And the government has emphasized now and again that we should avoid backtracking. In other words, once we are in a particular direction, we just move forward. We don't backtrack. So there seems to be a direction. Now, whether or not it is a roadmap is subject to interpretation. I would like to see that as a roadmap. This is a direction. We are going to be less restrictive. We are moving forward, opening up, but of course, according to a scientific and precise assessment of the situation. But because the 5 pillars are expressed in rather generic, general terms, as a roadmap, it is not sufficient to enable businesses to plan ahead. Now, we have seen the closing down of one of the largest tourism agency in Hong Kong recently. And I think we need to give business reassurance. So a more clearly articulated roadmap is important. What about the national policy? The national policy is that of dynamic COVID-0. We will give an English expression to the policy of 动态清零. But if we look at the central government's articulation of the current situation, I can identify 3 keywords. Dynamic. Dynamic means not rigid, in tandem with the changing situation, more proactive, more flexible. The second word, economy, because while we have to be very vigilant in controlling the epidemic, at the same time, we have to make sure that the economy is doing well. And of course, security, which is now an often articulated keyword in mainland policy expressions. Maximum prevention, minimum cost. So we have to review Hong Kong's policy, whether or not we are achieving maximum impact with minimum cost. So I don't see any necessary conflict with the national policy position. Now, this is my final slide. So how can Hong Kong be dynamic, and even within the national policy context of dynamic 0? And in crafting Hong Kong's strategy at the moment, we have to bear in mind Hong Kong's special position as an international hub within a turbulent global economy. If we are not careful, we might be caught at both ends. The general economic situation, which is becoming more gloomy, and because of the way we deal with the pandemic, we are shutting ourselves down. Is the risk of importation and domestic spread of the epidemic very serious, or not that serious? So we need to avoid broad brushing. We need to be more specific. What do the experts say? We have to give the community a more informed picture of the situation. We need some kind of re-narration of the situation. Right now, there's often this debate about 0+3 versus 0+0. I would say that those wanting 0+0 basically means as little control or restriction as possible. However, 0+0 is still not specific enough. I think we have to, what counts most is the substance of whatever new regime we are advocating. What happens to quarantine requirements? Right now, this is almost gone, right? Surveillance. We still have maintained surveillance, medical surveillance, but is the cost effectiveness sound? Testing, mobility. So we have to assess the cost benefit of whatever control measures we are taking. And if we are going to change those arrangements, again, we need to bear in mind the cost benefit calculation. For the roadmap, assuming that we are going towards the goal with this goal of back to normal, but in order to give hope and re-energize the community, I think we need to be more specific. Any KPIs, because everybody is talking about KPI these days, any milestones that we can highlight so that business feel that it's not just a general articulation, it's an articulation that has a strategy behind. So I think people and the community, particularly the business community, need more certainty to plan the future. Of course, nothing is entirely certain because of a pandemic, but as much certainty as possible right now, I think is very important to Hong Kong. Thank you very much.
Thank you so much, Professor Zhang, for those very deep insights into the pandemic and taking us on the journey over the last 2.5 years as the pandemic has unraveled. I would like now to promptly hand the floor back over to Professor Loy Tai Lok to hear his comments and insights into this subject. Professor Loy, please.
Yes, thanks. I probably look at the topic a little bit different from Anthony's and try to how would I say look at it at a more general level. Probably some people would criticize me by saying that what I'm going to argue is simply promoting something like lying flat, tongping. But I try to explain what's my argument and what the sort of things that we need to think about. And you like it or not, these days that we are all of us learning how to live dangerously in the changing environment. And let me start by saying, okay, you know, we always have risk. We always have new challenges. We probably may have pandemic. We may have warfare. We have natural disasters. We have all kinds of things. Ideally, of course, we would like to say that, you know, we would like to eliminate all this risk, old and new. I mean, we still have earthquakes and we still have other natural disasters. And of course, we also have environmental hazards and so on and so forth. Ideally, it would be good that, you know, we simply eliminate all of them. And so that in our everyday life, we don't need to think about risk. Otherwise, we always also want to say that, you know, okay, probably we can't eliminate all of them, but at least we can quickly diagnose emerging risk and find a way to cope. If we all recall, quite honestly, when we have the outbreak of COVID-19, at the very beginning, we have once at least hoped that, you know, okay, we have pandemic, but very quickly that we would know what it's all about. And then later on, then, you know, we would be able to find a coping strategy. And with this coping strategy, then even if we have new risk, they will be either contained, even better, you know, would be cured, but the least desirable scenario would be largely under control, you know, so that you don't really need to worry too much about it. And sometimes we very much like, you know, the sort of virus message that we receive from email that, you know, ideally we just identify them, quarantine them, you know, put them aside. We don't even need to open and have a look at the issue. So the risk goes on, but, you know, we cope by having all these measures. And then, you know, even better would be after knowing what's the risk, then we develop preventive measures so that, you know, next time before we have the outbreak, before things emerge, then we will all be immune. And as a result of that, you know, all this risk would become insignificant. Not so much they're not around, but, you know, it doesn't really matter anymore. Quite honestly, a lot of times we do have that sort of mindset, even for COVID-19. My recollection is at the very beginning, we still have kind of Hollywood movie imagination that, you know, probably 6 months, 9 months, then there would be vaccination, very much like Hollywood movie when maybe Dustin Hoffman, maybe Brad Pitt, you know, towards the end of it, you would have someone bring in everything is all right then. You know, that we always have that sort of thing in mind. But in reality, you know, very often we can't really eliminate risk. You know, they stay with us, you like it or not. We have this one, and then following with other kinds of risk. It's largely a matter that, you know, you want to pay attention to it or otherwise. So the sort of, you know, response that we have is to try very hard either to minimize the risk, so that, you know, we will not be fully exposed to this sort of risk, and so as a result, you know, the consequence would not be too damaging. Otherwise, we think of develop other means to help us to ensure predictability and reliability of our general environment, even though that, you know, is still haunted by emerging risk. For example, you know, our approach towards vaccination is something like this. You know, we know that, you know, COVID-19 will still be around, there will be mutation, and we change our perception of vaccination. At the very beginning, we thought that, you know, once we have vaccination, then you won't even be infected. But now we think that, you know, it's just about reducing death rate, reducing having serious conditions. You would still be exposed to it, but then the risk would be sort of minimized. So as a result of that, you would do the calculation of whether you would do all the 3 jabs or even the 4th one, so that you would minimize your exposure. As a result of that, you are still willing to travel internationally or attending dinner parties, taking photos on the stage, that kind of thing. Similarly, I mean, for a long time, I'm in the context of modernization and the rise of modern society, we develop insurance. We develop this sort of mindset as well as the system itself. It's exactly that, you know, the risk is still around, but we would like to minimize our exposure. You can easily imagine that, you know, 500 years ago, maybe people doing trade, that they send ships from maybe the Netherlands to Asia, and there were pirates all around major oceans. So as a result of that, you want to do business, you have to think about, you know, I invest in it, how much money I would get in return, and I want to reduce all the risks that I have by exposing myself to these oceans, pirates, typhoons, storms, all kind of thing, by buying insurance. And there's another company that, you know, would be interested in undertake it, so that, okay, you put a certain amount of money here, nothing happened, then I'll take it away. If something happened, you get compensation, and you calculate, you know, all these things become something calculable. So as a result, you just very much like betting, you know, you bet on the chances of having a loss or how to protect yourself. And in reality, we develop all kinds of measures and strategies like that. We do hedging, for example. We do insurance. All these things are telling us that, you know, the risk is still around, but you have measures about how to make sure that you won't be fully 100% exposed. By reducing the exposure, life is more predictable and life is more manageable. And this brings to the issues about policy. I think one of the interesting thing about COVID is we spent almost 3 years now on this issue. And I tend to think that, you know, all the governments around the world find it a headache. But in the process, I do think that, you know, there have been a lot of rethinking about what are actually the responsibility of the state. That cover issues like coverage as well as scope. If the state is going to assume the role of saying, under my governance, no one will suffer anything. What you need to do is just follow my instruction. I tell you to go quarantine, you do quarantine. I lock down, then you don't go out. I stop all the transportations, then stay at home. Or rather that you think, okay, now we have an assessment that, there will be mutation. We have vaccination, but it's basically not about you being infected or not, but we are trying to reduce death rates. We are trying to reduce serious cases. And so there won't be overburdening the medical system. And for ordinary people, you can more or less still run your daily life as if we are least affected by COVID-19. And in the process, I do think that, it also touched on issues about a kind of not necessarily contractual, but at least some sort of negotiation between the state and individual citizens' responsibility. Because if we assume, the state would be able to take care of everything, even though that, the individual citizens don't follow any of the instructions, don't care about vaccination, and do whatever they want, and still the public and the government would need to bear all the outcomes of that sort of, well, quote unquote, irresponsible action, then I don't think it will be something manageable. So quite honestly, throughout COVID-19, I tend to think that, we all globally exposed to a new challenge of rethinking about what exactly would be the state-society interface. What exactly is the kind of relationship that we have? The role of the state, the role of the citizens, the responsibility of the state, and the responsibility of individual citizens, so that, we would be able to work up a new kind of cooperation that make it manageable. So if you see it in this light, then you see probably different COVID-19, regime. It is a reflection of different states' perception of their own role and the expectation of citizens' responsibilities. So I thought a very general question, and like to conclude by saying that's why, when we go back to basic things about policymaking or policy issues, point number one is, like what Anthony has said, we need narration. I tend to be very skeptical about the argument about restoration of the normal or return to the normal, because in the short run, I don't think that, it's exactly pre-COVID-19 normal. So actually, we are redefining normal. And this normal, quite honestly, I tend to think that it's not exactly very new, because if you have a look at international travel in the 1960s, you would be required to take vaccination because getting on board of a ship to travel to some other countries. Of course, we probably hate that, because if you're coming from some countries, you'll be asked to take various vaccinations before going on board. But that's actually, it happened in the old days. It won't be changed entirely simply because of having new technology. So what is the normal redefined? What is the situation outside that we need to have a very good assessment? The second point I want to drive at is when I was writing this PPT, a term popped up in my mind, but I'm not 100% whether it's appropriate. It's a sort of bounded rationality in decision making. When we make policies, when we make arrangements, both for the state and for ordinary citizens, we make that kind of decision and take kind of action within the limits of current knowledge, reasoning, and technology. So like it or not, it seems to be, sounding a little bit funny, but we all need to be a little bit honest. Look, what would be the effect of vaccination? What would be the maximum benefit that it would have? And we take action and make decisions in the context of such limitations. That's all we can do. And this would be probably the most flexible scenario that goes back to the point that made by Anthony. It's at the end of the day, you need to think about balance between the economy and probably how to cope with COVID-19. So, of course, I would like to conclude by saying that, okay, probably friends out there would say, well, we have never seen a very honest government saying that, that's all I can do, what do you want from me? But in some way, we have to be honest about, the sort of steps that we can take, the sort of maximum reasoning that we can have under the existing context. Maybe there would be technological breakthrough some other time, but that's tomorrow. I'll stop here. Thank you very much.
Thank you so much, Professor Loy, for ending with these probing questions and for the philosophical ideas that you raised in earlier parts of your presentation. I would now like to hand the floor over to my colleague, Professor Donald O, who's a professor of practice at the Division of Public Policy at HKUST. And as you will see, Professor Low will not be shy in his remarks, and he'll be very equivocal in what he says. Over to you, sir.
Thanks very much, Nabaha. Thanks very much for having me at this policy dialogue. Virtual, actually. How do I switch the slides? This area. Right, so I'll talk. As Nabaha said, I will not hold back any punches. I think my argument here is that Hong Kong's COVID policy has been largely a failure. And I think one would have to be quite either ignorant or excessively defensive to think otherwise. And I'll provide a few reasons why I think, unfortunately, Hong Kong's COVID policy has been largely a failure. But first, I'd like to take a step back and sort of define some terms. Right? First, I think is before this, even before COVID-19, they were essentially in the literature two broad approaches to dealing with something like COVID or SARS or H1N1 or even the seasonal flu. The first approach is called containment, or in extreme situations, suppression. So this means mass testing, even compulsory testing, contact tracing, use of quarantine and isolation for all confirmed cases. And these protocols for containment and in extreme situations suppression were developed in the aftermath of SARS. I think I'm a Singaporean, so I remember SARS very clearly. The gentleman here, in Hong Kong, obviously SARS was also a very traumatizing experience. And so after SARS, we realized that SARS, which is lethal, even if it's not so transmissible disease, it's a lethal disease. It killed about 10% of the people it infected and caused widespread panic in the population. And so the approach that was developed after that was to, early testing of all suspected cases was essential. You may even have to lock down this parts of the city to reduce mingling. And the idea of containment is to bring down, or suppression is to bring down the caseload or the case numbers to a level that would not overwhelm the healthcare system or the hospital system. The second approach, which is suitable for viruses that are very transmissible but not deadly, is suitable for H1N1, the seasonal flu. And I would argue, as Professor Chong suggested earlier, this is probably the right approach for the Omicron variant and subvariants of COVID-19. And indeed, outside of mainland China, I think everybody else is pursuing this mitigation, which it's essentially about, we accept that the disease is here to stay, it has become endemic, it doesn't cause too many excess deaths, it doesn't cause significant stress on the healthcare system, and we can live with it. So we focus our healthcare resources on treating, mitigating the severe cases that contract this virus. I would say Hong Kong is somewhere in between the containment and mitigation strategy. I think nominally we are zero COVID, but in practice we are a hybrid of containment and mitigation. And in the mitigation strategy, vaccination and having sufficient healthcare capacity are critical. So let me illustrate this with the chart. So this is this chart, the upward sloping curve is the marginal cost curve of zero COVID measures, suppression measures. The marginal benefit curve, for ease of reference, I've just used a flat curve. With vaccinations, the marginal benefit of suppression obviously falls because not so many lives are at stake. Not so many people will die from COVID-19 large number, if most people are vaccinated, the overwhelming majority of people are vaccinated. Second, with increasing transmissibility of the virus, the marginal cost of suppression increases. For any desired level of suppression, measures have to be tougher or longer, and usually both. And so if you look at what the two new curves, new marginal cost and marginal benefit curves mean, is that the optimal level of containment is lower than the original level of containment. So I agree entirely with Professor Cheong that, right, as vaccinations increase, as people are exposed and recover from the virus, and as we get more transmissible variants, mitigation is the right strategy, right? It's the direction we should be heading towards. Look, also it's interesting to note that the intersection point of NC2 and MB2 is not zero. There might be a case for some containment measures like indoor mask wearing, as we are now doing. It's not a complete abolition or elimination of all containment measures, just that they are far less stringent than before. So the first argument I'll make why Hong Kong's COVID policy has been largely a failure is this obsession with zero COVID, right? And we know even at a very early stage of the pandemic, in March 2020, we know that lockdowns and other interventions which bring down the reproduction rate, we know that they save lives, but they don't create immunity, right? So when the virus comes back, when the lockdowns are lifted, the virus will go on to infect even more, potentially even more people. So this is inherently not sustainable. What allowed societies to move towards mitigation relatively soon, I think within a year or so, was the arrival of highly effective vaccines. And I think that has been what has allowed most countries, particularly developed countries, to start moving towards mitigation, to move away from lockdown and other suppression measures beginning in the second quarter of 2021. Also looking at this idea that besides vaccination, exposure, right, prior infections also build immunity. If you look at globally, you look at the world, we have had 4 or 5, most countries have had 4 or 5 big waves. The Omicron, obviously the biggest because it is so transmissible, but also not necessarily the deadliest because it is much less severe. Many people, especially in the developed world, most people in the developed world have already got vaccinated by the time the Omicron wave came along. In Hong Kong, we say the Omicron wave is also the 5th wave, but in practice, in reality, it is 1 wave or 5 waves in one, because our initial 4 waves in comparison to the Omicron wave were quite small. And so when we did have the Omicron wave, in a sense, we were hampered by the fact that we had this was a very immunologically naive population. So that explains the chaos, the overcrowded hospitals, the overwhelmed healthcare system that we saw in March, April of this year. This is a quote from this piece in The Economist that around the time of the peak of the Omicron wave, the chaos in the hospital wards has in part been caused by the insistence that anyone contracting the disease, even those with no symptoms, must be placed in hospital or government isolation center. Hong Kong has been complacent at all levels, says one public health expert. Officials have been proud of previously effective policy, previously effective containment policy, but they have squandered the success. They've wasted the time we had in 2020 and 2021 to improve healthcare facilities, to stockpile tests, to increase vaccination. Right. So I'll show a chart later. We showed that even as recently as March the 1st, only about 40% of Hong Kong's elderly, 40 to 50% of Hong Kong's elderly have been vaccinated. So the dogged pursuit, according to the Economist, the dogged pursuit of zero COVID is proving the final straw for many expatriates who are fleeing the city. As Professor Chung says, right, we are far more globalized a city than other Chinese cities. And this is an existential question when people are leaving, fleeing the city because of our zero COVID policy. I also wrote, I'll skip this. I also wrote a piece in March this year, which I said that actually this is not a black swan event, right? That we would have a big wave because this is an immunologically naive population, that our healthcare system will be overburdened, that the deaths would be concentrated among the old and unvaccinated. None of this was unforeseen. in fact, these were known risks. These were not unknown risks. These were not unknown unknowns. Right? So I written earlier in August 2021 about the need for a risk mitigation framework that would include vaccination targets and timelines, and emphasis on ensuring sufficient hospital and ICU capacity instead of obsessing over daily infection count, and a plan for reopening. But you have to plan, even if you don't reopen in the immediate future, you have to plan for it. You have to, as Professor Liu says, you must have a narrative. You must frame the discussion and tell the population this is what our roadmap is. This is our direction of travel. Also in August 2021, I had written that it was an indictment of Hong Kong, of Hong Kong society, of Hong Kong government, that the segments of the population that are the most vulnerable to severe disease and death of COVID-19, i.e. the elderly, are also the least vaccinated. Right? And I said that it is almost inevitable that when we face a large outbreak, it is almost inevitable that death and severe disease will be concentrated among the old and unvaccinated. And so it has been. The median age, I think, of COVID deaths in Hong Kong has been around 80. So it is indeed the case that COVID disproportionately kills and harms elderly people. So in short, this was no black swan event where we should have prepared for what was always a known risk. And that the authorities did not, maybe because of hubris, maybe because of the misplaced confidence in zero COVID. That's the reason Hong Kong still cannot afford to live with the virus. I mentioned earlier this concept of excess deaths. And I think that's a better metric for looking at how countries have performed in dealing with the pandemic. Initially, of course, we were very focused on cases, right? But as transmissibility of the virus increases and severity of cases fell, I think cases is less meaningful. Many people are asymptomatic. So, they don't even test positive or they don't even go for a test. So the cases, I think, are severe underestimate. Is really not a particularly revealing metric. COVID deaths are obviously useful metric, but I think an even more useful metric would be excess deaths. Actual number of deaths in excess of the expected number of deaths for that particular period. So if you, the gold standard for this metric, excess deaths, how many deaths did the pandemic cause? Whether it's by COVID-19 or not, like how many more deaths did we have over the course of the pandemic? If you look at the gold standard is the Economist's study of excess death, which is, I think, updated daily. So I'll use this to compare Hong Kong's performance, excess death as well as COVID death. Look at Hong Kong's performance against 3 other East Asian countries. Right? First, Singapore, second, Japan, and third, South Korea. So the first line shows official COVID deaths as of 18 October. Second line, using the Economist magazine's estimated excess deaths, we find that Hong Kong is, in the tens of thousands. Singapore is 2,800 to 5,000, and so on. Japan and South Korea. Let's normalize adjust for population size. So look at COVID deaths, official COVID-19 deaths per million people. Hong Kong, if you look at official COVID deaths, Hong Kong's COVID death rate as a percentage of the population, right, is 4 times higher, right? More than 4 times higher than Singapore's, about 4 times higher than Japan's, and about 2.5 times higher than South Korea. If you look at the Economist magazine's estimated excess deaths per million people, Hong Kong's death rate is also much higher than Singapore's, Japan's, and South Korea's. When you compare Hong Kong with Singapore, for instance, it's about 3 times higher. It's still 3 times higher. You look at excess deaths. The Health Secretary of Hong Kong had earlier mentioned that last month, he mentioned that we are different from other countries. We are glad that we are different from other countries. For example, the UK has suffered a very high casualty rate, The Health Secretary also compared Hong Kong with Singapore, saying that Hong Kong had much more of an aging population and ended up being a victim of our own success because we have the longest longevity in the world. Right? But if you look at the elderly population of Hong Kong, Singapore, Japan, and South Korea, Hong Kong's isn't particularly much higher. It's slightly higher than Singapore. Certainly, it's not high. The difference, the gap in the elderly, on the size of the elderly population between Singapore and Hong Kong, is not so large as to explain Hong Kong's much higher COVID fatality, COVID death rates. And of course, Japan has a much older population and has done better than Hong Kong in terms of preventing or limiting COVID deaths. South Korea has a similar elderly population. So as Professor Chung mentioned, if Hong Kong has such strict measures, maybe Hong Kong has done better economically. So first, Hong Kong has not done better on health measures. Neither has Hong Kong done better on economic measures. In the first half of this year, Hong Kong was effectively in recession. The economy shrank by about 2%. Singapore in the first half of this year, the economy grew by about 4%. Japan about 3%, and South Korea by about 3%. So if you compare Hong Kong and Singapore, the difference is between -2 and 4%. That's a 6 percentage point difference. It's a huge difference that can only be explained by Hong Kong's obsession with pursuing zero COVID. I was earlier interviewed by Ming Bao in March of this year, where I said that in terms of objective conditions, 客观条件, how the virus was evolving, how the disease was spreading, Hong Kong was only 1 or 2 months behind Singapore. But in terms of government thinking and planning and anticipation, Hong Kong was at least 6 months behind Singapore. And so when Singapore announced in April this year that it would abolish all quarantine restrictions, including for unvaccinated people, it was only 6 months later that Hong Kong more or less did the same. So let me explain why Singapore, like the rest of the world, decided to live with COVID. First, we realized very quickly that beginning in the middle of 2021, as vaccination rates have increased rapidly, we realized that COVID-19 has become considerably less pathogenic, less deadly, right? So the data in Singapore suggests, so this is from May 2021, right? So middle of last year to about February of this year. We realized that, right, among non-fully vaccinated people, the case fatality rate is about almost 1% across all, for all age groups. So that's much higher than the flu. So it's intolerable, right? But if you are fully vaccinated but not boosted, the case fatality rate is very similar to the seasonal flu of 0.1%. And you are vaccinated with and boosted, it's actually COVID-19 is actually less deadly than the flu. Second, the very important reason is why other countries can move to this mitigation approach is that more than 80% of the population, whether Singapore or most developed countries, were fully vaccinated against COVID-19 for COVID-19. If you look at those charts there, what you see is that, right, with the exception in most places in East Asia, Taiwan, Singapore, Japan, and South Korea, elderly vaccination rates are at least as high, if not higher, than the rest of the population. Only in Hong Kong and Macau are elderly vaccination rates much lower than the rest of the population. I don't want to be undiplomatic, but this is shameful, right? I mean, what makes Hong Kong and Macau so special that we can afford to have much lower vaccination rates for the elderly, the group that is most vulnerable to severe disease and death from COVID? A third, as I mentioned earlier, not only once you look at excess deaths, that COVID is not the only thing that kills, right? If you obsess too much over limiting COVID death, you might actually cause deaths in, healthcare resources might be diverted too much to healthcare, that it is causing more excess deaths from other conditions. So not only are there huge economic costs of continuing its suppression, there are also significant public health risks, right? Particularly in terms of misallocation of scarce health resources, right? And excess deaths caused by illnesses other than COVID. And finally, the case in the context of Singapore, at least, the population was over time prepared, right, and primed to live with the risks of COVID. So in June this year, the 3 ministers of the Ministerial Task Force in Singapore wrote a piece in the national broadsheet saying, titled "Living Normally with COVID," to indicate that this is the direction we're heading for the next several months. I would describe Singapore's approach of not counting, right, but of planning to live with COVID, preparing the population for it, and emphasizing personal responsibility. So planning, how do you plan to live with COVID? But make sure that vaccination rate goes up quickly. So by the end of 2021, Singapore's vaccination rate was in excess of, was about 80% fully vaccinated members of the population. Second, ICU bed capacity was more than doubled after June 2021. And during COVID, as you can see in this chart, at the peak of the Omicron wave, COVID cases never took up more than 20% of ICU beds. So we never had a situation where we did not have enough hospital beds or enough ICU beds for severe COVID cases. And of course, as I said, preparing the population for it in the article I mentioned just now. And COVID, very interestingly, was never framed as the enemy. Right from the start, as early as February 2020, the Prime Minister of Singapore had already mentioned that this might become endemic. This might be a disease that we will never go away. So already right from the start, the population was prepared for the possibility, if not the inevitability, the possibility that COVID will be with us for the foreseeable future. And finally, emphasizing personal responsibility in terms of getting yourself vaccinated, at least for the next several months, right? Where we still have, where the virus is still spreading, testing yourself with ART kits. And if you test positive, isolate yourself. So let me highlight finally 3 uncomfortable truths for Hong Kong. I said, I think it's quite clear that Singapore and most developed countries have outperformed Hong Kong in terms of ensuring low COVID mortality, despite, as Professor Chong said, despite pursuing a live with COVID strategy since 2021. What Hong Kong experienced during the Omicron wave in terms of very high numbers was not unusual. Right? What was unusual was the government's response to it, which neither saved lives nor limited damage to the economy. And finally, living with COVID is not pumping. Right? To characterize this as such is frankly quite insulting to those countries that have deliberately planned to live with COVID. And neither is persistence with zero COVID victory. Let me finally, Professor Liu talked about bounded rationality. And so here are some possible decision biases that might explain why governments or organizations might persist with zero COVID. I've highlighted 5 here: a saliency bias and a zero risk bias. The idea that people prefer to eliminate risk rather than to mitigate or live with risk. Second, loss aversion. We focus a lot more on the losses that a switch of strategy, a mitigation strategy might entail. In the short term, we will face a lot more losses in terms of death. And we tend to sort of ignore or underestimate the gains, right? Gains in terms of economic recovery, protecting people's livelihoods, and so on. Third, there's a sunk cost bias. I think particularly in the case of mainland China, which has invested enormous resources with dynamic zero COVID. The sense is that, right, if we now open up and we have lots of cases, all those initial efforts and resources would be wasted. Right? But this is, of course, fallacious economic reasoning. And whatever you do, those sunk costs cannot be recovered. Right? Decisions should always be made based on future costs and future benefits. Finally, I think there is an omission bias, certainly at the level of local officials. If I don't do anything, right, and subsequently we find out that I should have acted earlier, I should have opened up earlier, they don't get punished. But if they open up, right, they move away from the status quo, and subsequently they find out that you shouldn't have done that, right, they will be severely punished. So errors of commission, right, or sins of commission are more severely punished than errors of omission. So this leads to an omission bias, right? If you don't do anything, you stick with the status quo, you'll be fine, right? Because that's what everybody else is doing. And finally, there's something called hyperbolic discounting or present bias, right? We tend to focus more on short-term cost of benefit. So if we abandon zero COVID or end zero COVID, in the short term, at least for the next 2 or 3 months, we will have many cases. Potentially, the healthcare system might be overwhelmed, and those short-term costs tend to be amplified, right, psychologically, even as the long-term benefits of such a decision are underestimated. So thank you very much.
Thank you, Professor Low, for those unequivocal insights and indictment of Hong Kong's response. I think there's a lot of food for thought. I'm deeply tempted to start with you, but I would like to go to Professor Cheung first because he kicked off. And before I do so, I'd just like to ask the audience if they have any questions, feel free to type in the chat box or in the Q&A box, and I'll be happy to channel your questions to the distinguished speakers. Professor Cheung, I wanted to ask you regarding policymaking response in Hong Kong, which you alluded to, about the extent to which policymaking authority was taken over by a small group of experts, and the extent to which the experts' views and authority predominated significantly over all other policymakers, including economists, financial planners, and so on and so forth. So the subtlety that within this broad framework of policymaking, the extent to which one group became hugely dominant and hugely influential, maybe not just in the Hong Kong context, but worldwide at some points as well. Could you comment on that a little bit?
Well, I don't think that is the case as far as COVID is concerned.
Mhm.
Because if we look to various countries, and I mean, if you look at Hong Kong, yes, experts, obviously their views are important.
Yes.
However, when government makes policy, government has to balance different interests, different demands, economic demands, political considerations, how whatever decision made will be perceived by different sectors of the community. So I don't think that it's just policy making dominated by a particular group of experts or a particular sector. However, I think it is important to notice that the challenge faced by policymakers in 2020 was different. I mean, today is so different because if COVID-19, like SARS, ended a few months later, then I think Hong Kong would have got a very beautiful score, right? I mean, if you look at 2020, and at that time, why was lockdown so popular? I mean, China did it first, and then Italy, some European countries, because if you can really defeat, using the word defeat, COVID by elimination, and if lockdown did eliminate COVID, then everything is fine. However, because of mutation, because of a changing nature of COVID, then it has prolonged for so long, and it's still mutating. So in other words, even if you treat this as a war, you have to change your strategy. I mean, your enemy, even using the word enemy, your enemy is changing all the time. So you can't still use the old method. And remember, lockdown elimination, if we look at it as a economics-driven policy, at the end of the day, you want to have the virus eliminated so that you can restore economic activities, social activities as soon as possible. So you're trying to revive the economy. However, if whatever strategy you are taking today actually works against reviving the economy, that may not be desirable. I mean, if looking at it as a policy-making process. So my suggestion, and I share the views of others, is that you have to change your strategy, and you have to enable the community to realize why that change, why that adjustment is necessary.
Thank you, Professor Chang. Moving to Professor Lui, and please feel other speakers feel free to jump in as you please. I was really struck strongly by your comments about the need to reevaluate the role of the state. What is the role of the state? Is it risk elimination? Is it mitigation? Is it living, in this case, with the virus? And I couldn't help but see the irony when it comes to Hong Kong, that we have traditionally been known as a laissez-faire, non-interventionist city. However, when it came to our COVID response, we were heavily interventionist. We had a lot of measures in place at the height, where we had the height of the lockdowns and so on and so forth. And that is contrasted to Singapore, where we traditionally think that they have a highly interventionist state. They tell you how many babies to have, when to marry, and so on and so forth, whether you can chew gum. But when it came to the COVID response, we saw a divergence in terms of the state's response. So maybe I can start with you to comment on, was it something, was it our experience with SARS, for example, that led Hong Kong government in this situation to be so highly interventionist and to see themselves as a guardian for risk elimination, essentially?
I tend to take your point. The SARS experience, I think it's something always somehow shaping the mindset, and that previous experience, of course, shaped their decision making. And I think Donald's last line also highlighted a lot of biases in making decisions. That's why you would probably shied away from going back to the basics and think about what is exactly, you know, the interface between the state and the ordinary people.
Yes.
In the context of Hong Kong, because in Hong Kong it's sometimes you find it quite you may say sarcastic, self-contradictory, and so on and so forth. Like what you said, you know, it's supposed to be a small government, it's supposed to be laissez-faire, and so on. But for ordinary people like us, I mean, whenever you cross a road, any crossroad, you always find there's a sign right underneath you saying, look right. And then cross the other side, tell you to look left. What if you don't do it? Actually, nothing happened unless there's a car accident. It's the state sometimes is very verbose in the sense that, you know, keep reminding you what to do, and then there's a lot of government information telling you that, you know, there would be a junk mail, there would be, you know, all this forgery, all sorts of things. But at the same time, in the old days, the rationale behind was, hey, look, you as an individual, actually, you also take a lot of responsibility of taking care of yourself and your family. That's supposed to be the sort of Hong Kong culture and the long workout relationship. But like what you said, I mean, last time in SARS, it seems to work perfectly well. And what Anthony just mentioned, you know, if COVID-19 happened at the same mode, just lockdown 3 months and then everything is gone. It's the virus simply disappeared. That would be a perfect ending. But exactly, I think what we should learn from COVID-19 is everything is evolving. The risk actually is unknown. And you need to keep on adapting and to collect new data and to have new assessment. And apparently in the context of Hong Kong this time, it happened to be fixated in a certain strategy and then not able to move out of it and have a look and say, hey, this is a new scenario. Or even that, you know, what we have decided 3 months ago, thinking about sunk costs, forget it. You know, we need to start anew and to adopt a new strategy. So you're quite right. With that sort of preset framework that you have in mind, it's difficult for them to get out of it.
Professor Low, would you like to comment on that point about the role of the state vis-a-vis the traditional, stereotypical roles?
Yeah, I think the comparison with Singapore is quite instructive. As Nava, as you mentioned, we tend to think of the Singapore as paternalistic, interventionist. But actually, in this particular, before the pandemic, we had said that if there was this epidemic, Hong Kong would be the one that would be insisting on very stringent rules, you know, limiting arrivals from overseas, keep its economy on this war footing for 2 years. And Singapore will be the one that's welcoming and opening up and living with the disease. You know, we would say you got the predictions wrong, right? It should be the other way around. And so it's been quite counterintuitive. And also you look at how Hong Kong deals with other sorts of risks, whether it's financial risk or risk of retirement, you know, whether people achieve retirement security, risk of investing. In all these cases, I think the Hong Kong government philosophy is really buyer beware, individual responsibility, compared to Singapore when it comes to housing, health, as well as retirement security. The state at least puts in place the mechanisms and the institutions to mitigate risks, right, or to limit risks for citizens. So perhaps Hong Kong's excessively zealous approach is precisely because the state doesn't underwrite or insure citizens against so many other risks that it is arguably because it is expected or there is pressure for the state to say on this particular issue you have to do more to shield citizens or to protect residents from the risks of COVID. So maybe there is some idea of a balance, right? That if there are existing risk mitigation institutions and mechanisms already in place, then maybe the state isn't expected to to provide the main to be the protector of first resort in the case of something like an epidemic.
Going back to Singapore, one thing that struck me during your presentation, Professor Low, was how you mentioned on one of your slides, they made 6 months forecasts and predictions. What could that explain the difference between Singapore and Hong Kong, where Hong Kong was, and this is one of your biases as well, fixated much more upon the shorter term,
right,
without a deep enough involvement with what the 6-month, 1-year scenario would play out, the medium-term scenario would play out like.
I think the key word here is scenario rather than making forecasts.
Yeah.
And the key word is to plan. Your plan may turn out to be wrong, but it is important to have a plan and to keep adapting the plan. So when Singapore announced in June 2021 that it was shifting towards a mitigation, live with COVID strategy, that was not something that you would do immediately. There were still restrictions, there were still quarantine requirements, but we said that this was the direction that we're heading towards. This is the direction of travel. In terms of the specifics, in terms of when we will get rid of quarantine requirements, when we will get rid of outdoor masking rules, that obviously will depend on how the situation evolves. But you must have a plan, and the plan must be, even if you can't give specifics on timeline, even if you can't make specific or very precise forecasts or predictions, you still need to have a plan, and that plan needs to be communicated, needs to be explained to the population, you need to convince the population that this is the right approach in terms of balancing costs to public health versus the benefits to the economy and to people's livelihoods when you switch to a mitigation strategy. I think that was the crucial difference. In Hong Kong, there really was no mitigation plan. There was only one plan, which was zero COVID. And even that zero COVID plan was overly reliant, in my view, on long quarantines. You recall up to end of last year, it was 21-day quarantine. So the idea was, if you can stop importing cases, we have effectively dealt with the virus or with COVID-19. They never thought of what if. That's the whole point of scenario planning. And what if a couple of cases of a highly transmissible variant slip through the quarantine? Because even though you are quarantining human beings, there are other things which are coming in which are not quarantined.
Sure.
And some human beings are not quarantined as long as 31 days. So I think they should always have had a plan B, mitigation. The fact that they didn't, I think, accounts for the huge difference in performance between Singapore and Hong Kong.
Yeah, Professor Chen, you would like to add
Yes.
to that?
Now, whether or not the Hong Kong government had sufficient sort of forward planning throughout the 3 years, it's difficult for us to tell.
Sure.
Because I'm looking at what the government has been doing now as an outsider, as an observer. But I can see that up to the end of 2021, last year, the government seemed to be rather satisfied with progress. Because if you look at the trend, it was okay.
Yeah.
Actually, late last year, for about 8 to 9 months, we have single-digit infection. And that was beautiful figure. And all along, at least until end of last year, the government was working towards reopening with the mainland first. That was the priority. So a very stringent regime can help to assure the mainland authorities that there was very minimum risk of spillover from Hong Kong. I think if we put the situation at the end of last year, that seemed to be a rather logical kind of thinking. But of course, nobody anticipated Omicron and the game-changing nature of Omicron. I think if you look at Hong Kong's performance throughout the past 3 years, the turning point was early this year because of the 5th wave. And then the fatality rate among the elderly, I think that was very serious compared to other places. And I think that was Hong Kong's major failure. And if we look at the case fatality rate over the past few months during the so-called 5th wave, the figure I have is among the elderly, the very elderly, those over 80 years old, the case fatality rate was 12.5 for those who were unvaccinated or only vaccinated with 1 dose. But if we talk about those having at least 2 doses, then the case fatality rate for those over 80 years was only 2.69. So you can see a difference. If Hong Kong had did much better in terms of boosting vaccination, I think our case fatality rate would not be that terrible. So that was one thing I think which does reflect slow reaction, at least on the part of government last year.
Thank you. We have a question from one of the attendees that I would like, it's a difficult question, so feel free to give philosophical answers, but I'd like to start with Professor Lui. Given the role that you mentioned, you spoke quite a lot about the role of the state, the interface of between the state and citizenry. How do you think this pandemic will play out in China, given their specific contextual situations vis-a-vis citizens and the state? What is the end game? What is that direction, or how can we make some certain not predictions, but some ideas as to the scenarios that may evolve vis-a-vis China?
Quite honestly, it would be quite difficult because I tend to think that, you know, all these factors of consideration in mainland would be quite different from other countries, partly because of the sunk cost. You know, you've been fighting this long battle for such a long time, and now if you give up the idea of dynamic COVID zero, it seems to be you know, very difficult to rationalize what you have done. But at the same time, I still think that, you know, it would boil down to economics, the conditions of the economy, and even just the domestic economy. All these factors would be pertinent. And so how to make it an end game? I think that we shouldn't totally underestimate the possibility of a drastic turn.
Sure.
Because if now mainland is saying that, you know, that they're going to have a new way of taking care of vaccination instead of the jabs that we take, probably would be inhalers. And would that be able to be a way to justify that, you know, this can be done more massively and more effectively? And so as a result of that, probably all these drastic measures can be changed and readapted. It's difficult to say. Whether it would entirely reopen to the international travel, that I think would take a longer time, but at least within mainland itself, would there be a drastic change in the direction? And still, I mean, don't underestimate the sort of rhetorical turn of the Marxist dialectics. Quite honestly, for all of us here, how to make sense of dynamic zero, it's not easy to say, because it's never being boiled down to say that, you know, we got to be zero, but it's dynamic. As long as it's dynamic, it means that things are under control. So I do think that there are room for them to make a major 180-degree turnaround. But the thing is about the timing. But if you ask me to make a bet, I think the timing would be closely connected with economics.
Right. Professor Low, any comments about next 6 to 18 months unfolding in mainland China?
Yeah, I think it's hardly any chance that there will be any significant or changes to the implementation of zero COVID, dynamic zero COVID in 2022. I think earliest we can expect any sort of changes might be after the winter of 2023. So maybe March onwards. But as Professor Liu says, I think two factors. First is economics. Obviously, zero COVID is having a hugely negative economic impact on consumer sentiment, on investor confidence, on you know, consumption in general. So obviously, it is the main drag, I would argue, on the Chinese economy. So the economic considerations would be one factor. The other would be human suffering. Right? It is just psychologically extremely difficult to have to live through the uncertainties and the anxieties of lockdowns after lockdowns. Even if they say this is dynamic and targeted, just the sheer anxiety that you can't travel. I mean, even if it is possible to go to Hainan Island, what happens if there's an outbreak in Hainan Island? You'll be stuck there for, I don't know, a week, 2 weeks. So I think that sort of thing, the kind of hidden psychological costs might be as important as the actual hard economic data figures that zero COVID already is causing.
Yeah, I refer to that as the constant mental anguish that people have to endure without this certainty, you might not be able to run your business tomorrow, you might not be able to leave your home tomorrow, and all of this gradually builds up. Professor Zheng, I wanted to come back to you, and from your vantage point, after all that we have discussed and seen in this session today, what do you think are the key takeaways for Hong Kong's policymakers for a future pandemic? What are the, I'm sure there are many, dozens of takeaways, but what are the one or two broad brush takeaways that Hong Kong policymakers ought to learn from the experiences of the last 2 years and 10 months?
Well, first of all, I think we have to realize that with time, the nature of the epidemic threat and the actual impact is different today as compared to 3 years ago. So perhaps at the beginning, elimination could be a very immediately a very sound policy strategy. But now I think even on the mainland, we are not talking about COVID-0. We are talking about dynamic COVID-0, which is different. So we have moved from elimination perhaps at least to containment. And then gradually, if this virus is becoming so endemic, then actually it is how we manage the risk, not so much to eliminate the risk. I think that kind of transformation needs to be recognized. Secondly, yes, we are part of China, and therefore the national policy to some extent is very important. But the key word of the national policy is dynamic. Dynamic meaning that different parts of the country can have different reactions. And then Hong Kong is a special administrative region. Hong Kong is an externally oriented economy, whereas the mainland is slightly different. So I think up to now, the way we deal with COVID, the actual way we deal with COVID, is quite exceptional if you look compared to the rest of the country. So therefore, I think we need to be more conscious of our unique position. And at the moment, I think it is less pragmatic, less realistic to expect immediate reopening of connection with the mainland. So I think we should do more in terms of opening up to the world. And I think that's very important to restore Hong Kong's international competitiveness.
Professor Loh, maybe I could ask you the same question, but framed differently. Your title of your talk was why Hong Kong's response has been a failure. So if there were just one or two reasons, the most important, as you mentioned, there are many biases, many factors that played into it, but what, in a sentence?
Yeah, plan, prepare, and emphasize personal responsibility. Plan for, the fact, precisely because the virus is constantly evolving, you have to come up with contingency plan. You might have a preferred strategy, you may have a preferred ideal world. Maybe that one is a world of zero COVID elimination. But it is almost unforgivable that you did not plan for a world where this thing is not going away. It is almost unforgivable. It cannot possibly be the case that you, as recent as end of 2021, you were still thinking that this thing might be eliminated. And if this thing cannot be eliminated, then you have to plan, right? Even if for the possibility that this thing is going to be around for the foreseeable future. And second, prepare, whatever your plan is, prepare the population for it, right? Even if the plan is not, or even if there are a few contingency plans, right? And that, if A occurs, we pursue plan X. If B occurs, we pursue plan Y. You have to communicate that to the population. You have to prepare the population for that. And finally, I think nothing beats personal responsibility. If all the onus, the burden of decision-making adjustments or dealing with this pandemic is placed on government, you are only using a very limited capacity that society has, right? That social institutions, that non-profit groups, that civil society have. So I think that is another lesson that I think Hong Kong could learn from that. There are a lot more community and social resources that it could have tapped, the government could have tapped on in dealing with COVID-19.
Well, I agree with that very much. I would like to now put the ball in Professor Loh's court, because there's one thing in your presentation that was also quite insightful when you mentioned that to some extent, this is not new. Having travel vaccinations for yellow fever was very common in the 60s and 70s. having travel vaccinations now is somewhat common. The extent, so my question is the extent to which we could have learned from past epidemics and quite recent past experiences. Do you think that was exploited sufficiently? Learning from the recent past, the 50s, 60s, 70s, and 80s. I'm not even talking about the Spanish flu, which is many, many more decades in the past. But do you think that that was leveraged sufficiently, learning from past lessons of similar instances of pandemics and so forth? Because I agree with you, there are some elements of this that were not new. Quarantine has been around for centuries.
Yeah, for centuries.
Yes.
No, I don't think that we have learned sufficiently from past experience, and in fact, even from what's currently going on in the real world. For example, dengue fever.
Mm-hmm.
Do you really have a vaccine or any
Mm-hmm.
preventive measures with that?
Mm-hmm.
No.
Mm-hmm.
Would that prevent you from, say, taking a holiday in Cambodia?
Mm-hmm. Mm-hmm.
No.
Yeah.
Why? Because you think that, okay, as long as the number of cases is quote under control, as long as you have individual measures to prevent yourself being ever attacked by a mosquito or whatever,
Mm-hmm.
you think that you're relatively safe. So one of the very interesting thing, in the COVID-19 cases that I still, probably most of you won't agree with me. I still think that we at the very beginning we come up with a typical Hollywood mindset,
Yeah.
really thinking that okay, this is a crisis, but it will only last for 3 months.
Yeah.
Everything will be all right by the end of it, and because the hero would fly in and there would be vaccine and we all get cured. Even if not this case, things would be very much under control. It would go away. And so as a result, you pen on this sort of imagination of how to deal with it, instead of, like what you said, going back to history and reality, that actually there's still quite a lot of various sickness that we're not quite able to 100% sure how to contain it. But we work on certain measures to say we minimize it. Same thing. I mean, if the starting point of the approach is saying about minimization to cope with COVID, I'm sure that it's not exactly a fair comment, because at the very beginning, of course, everyone will say that we want to really get rid of it. But as it evolves, when you change to is a strategy of minimization, then I think it would be very different. And then the way you convince people to talk to ordinary citizens also would be very different. I mean, check with your grandmom. She took jabs when she was young. She needs to do that in order to travel. So we're back to it. This is the only way that you, as an individual, can help. And in fact, that breaks the point on mainland. The tricky thing is, even if I have taken 3 jabs, if I go to Hainan Island and suddenly there's an outbreak, there's no way that I would raise my hand and say, okay, wait, look, I should have some sort of priority to go back home. When you don't have that, then you don't have predictability.
Correct.
And once you don't have predictability, it's very difficult to do business. And that's, I think, a question of ABC.
Two of our speakers mentioned the median age or the elderly, those aged 80 and above. I'd like to take that direction to a slightly different mold. Even though it has been well proven that the elderly are the most vulnerable as far as this disease is concerned, there have been a lot of voices raised in Hong Kong that the children have suffered disproportionately rather than the adults, and in particular, the elderly who are not highly vaccinated with 2 or more doses, who are much more likely to be severely ill if they contract the disease. Any comments on the disproportionate impact that our restrictions in Hong Kong had for different categories of population? Youngsters, children, school-age children, adults, working adults, and the elderly. Maybe I could start with you, Professor Loh. since you,
Maybe.
Yeah.
Let me think about it.
Well,
Yeah.
I think this is not something peculiar to Hong Kong.
okay,
If you look around the world, for most countries, vaccination among children, among infants,
Mhm.
started much later
correct,
than those for the adults.
Yeah.
I think that's partly to do with the effectiveness of the vaccine,
Mhm.
because the vaccine was originally developed mainly for the adult population. But gradually people discovered that even children, infants might be affected. However, I think the issue rather is if for most scientists, for most experts, they know the elderly because of the age and because sometimes they have other illnesses as well.
Mhm.
They are definitely the more vulnerable group in society. Therefore, if you can't convince them or persuade them to get vaccinated, that may be a major gap. So I think if you look at Hong Kong, the reason why the fifth wave has resulted in such high cases of fatality is mostly because of the elderly population having a very low vaccination rate.
Yeah.
So as a strategy, I think that should have a feature on the government's planning board,
Mhm.
in my view, because that could be anticipated. And but because of the fifth wave, it came almost so suddenly in a way, and therefore everybody was caught in surprise. But I think yes, sometimes science is not exactly an exact science.
Yeah.
But sometimes part of it could be anticipated. But of course, for policymakers, often you have to make policies even though the science is not exact.
Professor Low, any
Yeah, I
comments?
agree that the young who are actually not particularly at risk at all, right? I mean, the mortality rates among young people, even for unvaccinated children, it's effectively zero,
Mm.
right?
Mm.
So why should they have paid such a high price in terms of school closures, in
Mhm.
terms of limited opportunity, especially for young kids who learn through human contact, right?
Mhm.
Face-to-face contact. I think the risk invisible costs are the lost years of learning, not just formal education, but just early childhood development that all these COVID restrictions have caused. And it may be impossible to calculate these costs. It's one of the questions were asked, but they are nonetheless very significant costs. And just because they may not be calculable doesn't mean they are not large, right? In terms of these millions of children not having access to development opportunities, having school closures, having families that do not have enough computer resources, not having. So in terms of educational inequality, school closures also have a disproportionate impact on educational inequality.
Professor Loy, any comments on this?
I still think that if we ever have a chance of turning the clock back, I think it would be wise to change the entire set of narration of exposures of old people to the high risk and so on, so that the rate of vaccination would be changed, and that would create rooms for probably more flexible arrangements for school kids and other related activities. I do take the point that the effects of all this loss of human interaction and learning experience would come out probably 3 years later, 5 years later, and then by that time,
People forgotten about COVID.
yeah, we probably said, oh, that's too bad, and so on. It's very unfortunate. But in order to cope with it, I think at that stage, it's really about how to re-narrate the whole arrangement so that vaccination rates would be able to jump up, so that you would be able to split how younger people would still retain the so-called normal school life, but at the same time we still keep infected cases to a low number.
So we've talked quite a bit about future lessons that we can learn. We've also talked a bit about the lessons we could have learned from the past. I would now like to bring the needle back to the present, July 1st onwards, these 4 months, particularly John Lee's tenure as our chief executive. And I would like to discuss specifically this idea of not returning back. Now, the significance of this this slogan that once we make a decision, we're not going to, like a pendulum, go back and forth. We're going to try our best to forge our way in the direction that those decisions indicate, which does bring an element of certainty to society, that we are on the path of gradual easing of restrictions, and the likelihood of the pendulum swinging back so we have lockdown again is less and less. And I would like to start with Professor Cheung. How significant do you think this new regime has been, this introduction of this idea that we will not be going back in terms of our measures, and the implications that has for Hong Kong society writ large, business, sport, finance, and so on and so forth?
Well, I think to state very clearly that it's not going back. We're just moving forward. I think that's important for two reasons. First, it has taken past lesson into account, because if we look at 2020 and part of 2021, sometimes we loosen up and then we tighten again and then loosen up. So there is really no predictability, no certainty for business, for all the people. And I think for most people, we need some kind of predictability. So that has taken past lesson into account. Secondly, in a way, short of telling people, well, there is a roadmap, because government somehow hasn't come to the point of saying, well, here is the roadmap, then at least telling people we have a direction, and that direction is towards more opening up. I think that is also important. It's important, but I think it's not sufficient.
Okay.
Because for business people, for ordinary people, we always look at the present. The present regime is still rather restrictive compared to many places, Singapore and other places. Now, if we tell people, sorry, we can't tell you whether the present situation might change and how long it would take to change. What if the current situation prevails for another 6 months, 1 year? Then Hong Kong would be in great trouble. I mean, if you look at the economy. And what if, and then you haven't told people, based on what are you sort of deciding on the actual measures? That's why I emphasize the importance of an informed picture. And the experts should be given a say to tell people, to share with people. Do we look at infection numbers? Is that the most important? Otherwise, if people still think that infection is important, because that was the wisdom back in 2020, then we are having 5,000, 6,000. I mean, in people's minds, that would be serious. But is that serious? Experts will say, well, that's not the most important figure. We look at the fatalities. We look at the serious cases, ICU has hospitalization. How do we fare in those figures? I think we need to come out more clearly. The narration, the re-articulation of the threat is important. If the threat is really serious, according to the re-narration, then people will be more willing to accept a more restrictive regime. Otherwise, if they look at other places, then other places seem to be having similar sort of numbers, but they're opening up. People are not worried about going there. I mean, for Hong Kongers, we go to Singapore, we go to Japan, and many places. So there are gaps that need to be filled.
Thank you. Professor Loh, to what extent do you think that we have turned a corner with this current regime installed since July 1st and this idea of not flip-flopping between our response?
I think absolute or objective terms, we have indeed turned a corner. As Professor Cheung says, there is merit. There's obviously good news that the government says there wouldn't be a turning back, and the direction is now firmly towards ever more easing of measures. But I agree entirely with Professor Cheung. You need to have an articulation of under what conditions will we continue easing, rather than to leave it vague. You need to also have a timeline. Of course, governments always need wiggle room, right? Subject to no worsening of, right? We will open up by when. I think those would give businesses as well as ordinary people some degree of predictability, not certainty. And third, I think risk communication, right? Saying that constantly telling people that actually, as Professor Liu says, there are all sorts of risks.
Yeah.
In mainland China, they say, oh, the US has had 1 million deaths. How terrible is that? Well, guess what? In mainland China, every year there are 1 million deaths from tobacco-related diseases alone. And this is every year, not just during a pandemic year. Every year there are about 1 million tobacco-related diseases. I mean, these are risks that we, society, have accepted. And we don't see a need to, I mean, nobody talks about zero tobacco or zero tolerance for tobacco in China. So I think constant reminders or constant communication of the fact of all sorts of risks that we as society have come to accept, live with, would be very useful. And finally, I think much to be said about excess deaths. That's a metric that we don't focus enough on. If we fixate on COVID deaths, we may be missing the wood for the tree, right? What really matters for the health of society is our deaths this year or over the last 2 years significantly more than what we would have expected in a normal year. Most people in Singapore, in Hong Kong, don't know that in a normal year we have 60,000 deaths a year, which means on a normal day there are about 150 deaths, 160 deaths on a normal day. So if you say that we have 7 COVID deaths, which has been the number of COVID fatalities over the last 2 weeks, 7, is that a lot? That's less than 5% of the daily number of deaths we would have from all other conditions. So COVID is no longer causing, it is no longer a source of excess deaths, of significantly high excess deaths. It is in fact become endemic. It is now part of the various respiratory conditions that our healthcare system has to deal with, has to cope with. And as long as we can maintain it at that level, right, that this is not causing many excess deaths, right? Then we can start treating it as just one of many diseases that we have learned as a society to live with, to accept, and to mitigate rather than to suppress.
Thank you. Professor Loy, in your presentation, you alluded a number of times to the deeper relationship between citizenry and the state. Do you think these last 4 months indicate a change in relationship, or is it just operationally changing measures and directions? How do you interpret the last 4 months of our new chief executive's performance vis-a-vis the COVID response?
I think it's still touching on the surface of it. And of course, in terms of policy, it's turning the corner because once you declare that there's no backtracking, there's no pendulum swings, it improved certainty and predictability. But don't forget, for ordinary people, there are still two very important dimensions, still very important components in ensuring that, life is sort of going back to the new normal. One would be consistency. The other would be underwriting. Consistency would be very important because when the government say, there won't be backtracking, but at the same time, the number of cases have increased from 3,000 something to now 5,000 something. Is it meaning anything? But probably statistics wise, you can say, oh, it's insignificant. So we can just ignore them. But for ordinary people, they will say, okay, that's 2,000 per day. What do you mean? I do think that, the government now should really sometimes be frank to people that, the number of reported cases, the meaning of it has already changed a lot. Yeah. I'm sure that every day there are people infected, probably with no symptom, probably just have a sour throat. They decided not to report, right? So you need to tell people that, you don't judge the sort of policy arrangement according to these indicators anymore. We look at some other things, and we would work out a consistent plan so that you still need to wear a mask, but now you can go to barbecue. But why not camping? Then you need to explain to people that, what's the difference between BBQ and camping. So I think the next stage, ordinary people here in Hong Kong would press on the issue about consistency. How are you to tell me that, I know no backtracking, but what about the next week, next month? I have some projection of what's going on. The fourth dimension is something that I still find it a little bit unfortunate, because it's not only the responsibility of the state, it's probably partially at least responsibility of the market as well, because at the end of the day, we can't eliminate all risk, we can't cope with everything, but somehow you need to find an agency to underwrite that if I put certain amount of money or whatever, or if I do something, so that I know I would be at least partially protected, so that I would be able to minimize my exposure, like buying insurance, like saying that, you know, if I really want all my kids to go back to school, would there be some sort of agency in our society to underwrite the risk, so that I know when I ask my kids to go back to school, you're going to have the final exam in the hall. We know, you know, how much risk we need to bear. We haven't really gotten into that part yet, but I think it would be important. But it's coming out. I mean, when international travel resumes, that of course now we would buy international travel insurance with the COVID item. Though when I look at the finer prints, I don't really find them really that helpful, in the sense that probably you never claim it. But at least appearing somewhere would help people to cope with it, because I'm probably a little bit cynical in the sense that I keep saying that, you know, you can't eliminate all of them. So in the past 300 years, I think modern people's coping strategy is we change the nature of the issue. We can't eliminate risk, but we have insurance. We can't really deal with all kinds of disease, but we have vaccination. You know, it's the way to move forward.
Can I chip in on this? Now, assuming that we have to accept that this COVID-19 risk is to stay for a long, long time, in different degrees or different forms of severity, then the question is how to live with the risk, right? To manage the risk. Actually, there are all kinds of risks that we face every day. The stock market has fallen rapidly over the last week. But the ordinary people, investors, they bear the risk. The government has not provided any insurance. Nobody can provide insurance. So in other words, in our daily life, there are risks that we take as given. We have to take our own responsibility. Nobody will give us insurance. There are other risks that government might provide some insurance. Then the question is where's the line? How should the line be drawn? Because taking the example of the case of a few doctors signing off exemption certificates for people who don't want to get vaccinated. Now, the whole reason why there are only a very small number of GPs are willing to give exemption certificates is that a majority are worried about risk. They don't want to bear with the legal consequence. Now, whether or not government could do it, I mean, ideally, maybe instead of asking private GPs to do it, well, those who don't want to get vaccinated for good reasons, health reasons, why can't they go to a government agency and get the exemption? So these are some of the questions we need to think about. If we want to reassure the population that, yes, they have concerns which are legitimate. And here's how we can deal with those concerns.
I would like to, for my last question to the panel at large, I would like to discuss the changing global landscape. COVID came out about end of 2019, early 2020. We're almost entering 2023. In this period, not only has the world and Hong Kong suffered from this pandemic, the Ukraine war has started. Interest rates have shot up. Stock markets are now fluctuating wildly, not just a drop in Hong Kong, but even in overseas stock markets. China's new leader has been reinstalled, existing leader has been reinstalled for a third term. How, with this changing backdrop, global geo-economic backdrop, does that influence, should that influence Hong Kong's COVID strategy? Are there any policy responses that need to be made vis-a-vis COVID, but now taking into this consideration this new picture that has emerged over the last 3 years? Maybe I can start with you, Professor Zheng, because you did talk about stock market and also China's Congress.
First of all, we have to acknowledge the Hong Kong's economic lifeline rests a lot on our global connectivity.
Absolutely.
If we are cut off, then Hong Kong is finished.
Yeah.
We can't just rely on our domestic economy. We are different from other economies. So we are similar to Singapore in that sense. But right now, because of the Ukraine war, we all know that the world is becoming more turbulent, and we are facing a supply side crisis, energy crisis, cost of living, and then if we still deal with COVID in a way that implies lockdown, more restriction on activities, interflow of people and goods, then we instead of finding a solution, we actually making the problem even graver. So I think that's a challenge. And for Hong Kong, we have this double or even triple whammy. We are cut off, or our connectivity to the mainland is being hindered, and our connectivity with the rest of the world is also being hindered. So whatever strengths that we had before COVID seem to be working against us now. And if the world economy is going to become more turbulent because of Ukraine, because of the worsening global geopolitics, then I think we'll suffer more than other economies. And for the mainland, or for China as a whole, the whole purpose of Hong Kong as a special administrative region under one country, two systems, is to achieve what other cities on the mainland cannot do. Now, if our comparative advantage in terms of global connectivity, in terms of being a very flexible city cannot be realized, then we might be at the other end of the queue. That's what I'm worried about.
Professor Low, maybe your final comments on this changing.
Yeah, I think many of the trends that, or many of the challenges or headwinds that the global economy now faces were already emerging even before COVID hit us. I mean, most obvious would be the slowing of globalization. Trade, over the period 1989 to about, or 1988 to about 2008, over a 20-year period. That was the period of hyper-globalization. Trade as a percentage of world GDP doubled in that period. Since then, it has not increased at all. Right? Globalization is not reversing, but it is clearly not growing or increasing at the pace that we saw before the global financial crisis. And of course, all COVID has done is to amplify that trend and to make it accentuate it, make it more salient to decision makers. So I agree with Professor Cheong that, precisely because Hong Kong, like Singapore, was such a major beneficiary of hyper-globalization, of neoliberal globalization, potentially we would also be the big losers if this trend were to persist, right? This trend of slower or even deglobalization were to persist. A second factor which COVID has amplified, of course, is we should expect a lot more disruptions to supply chains going forward, not just from COVID and other epidemics, but also from climate disaster, which we spend quite a bit of time on pandemics, but actually the larger long-term risk that is going to cause a lot more losses of lives as well as damage to economies will be climate risks. And I think that's a major risk that decision makers and governments across the world have not really grappled with. Right? We have not really thought about how do we mitigate. It's almost a foregone conclusion that we will have significant climate change. Whether that's catastrophic depends on how we respond to that climate risk. And I don't think any government has done a sufficient job in planning for the kind of climate scenarios that we need to plan for in the next 20 to 30 years.
Professor Loy, last words on the changing global landscape.
Well, very quickly, I think the changing landscape boils down to decoupling and, well, not exactly appropriate word, but still, it's to some extent deglobalization. But exactly, under that sort of context, that I think Hong Kong's major function to China would still exactly lies in its own global connectivity and internationalization. But I do think that Hong Kong needs to learn to play this game again, but with new skills. Whereas the old skills that we have is very much US-centric, UK-centric, and we are very much English-speaking, medium-only kind of global strategy, and so on and so forth. We have limited visions about Southeast Asia. We have very limited visions about the world outside of US, Canada, Australia, and UK. We need to learn how to play this new game with new sets of new skills and new niches. And I think finding the new space would be the biggest challenge in front of us.
Fantastic. Well, we are at our allotted time, so all that remains for me is to thank our speakers, Professor Anthony Cheung and Professor Loy Tai Lok, for this first in our 5 policy dialogue series 2022 to 2023, and not least Professor Donald Low for accompanying them. I have been the moderator, Professor Nabahar Sharif, acting head and professor in the Division of Public Policy at HKUST. The next policy dialogue will take place on Saturday, the 3rd of December. It will feature our 2 permanent speakers, and they will be accompanied by Professor Christine Low. And the discussion topic will be what we ended off with: is development and environment an irreconcilable dilemma? Can they be reconciled, or are they irreconcilable? And our 3 speakers will discuss that topic in our next series on the 3rd of December. Please do join us then. For all of us here at Education University of Hong Kong for today, thank you so much for joining us, and we hope you enjoyed this first kickoff series. Goodbye.
Thank you.